was extended until midnight tonight. So major outdoor events taking place today and throughout the weekend are still scheduled to go on as planned, despite the recommendations from city officials.
We are not at the point where we are mandating the shutdown. We're giving very clear, sound recommendation. I thought Dr. Vasan was very clear. Now each entity must make the determination of how they're going to use our recommendation.
So the warning still stands, right? The air quality is still a bit of an alert today to avoid strenuous outdoor activity, to wear that mask today, at least through the weekend when the air quality is expected to improve, like Byron's been talking about. But we are joined right now by New York City's Health Commissioner, Dr. Ashwin Vasan, who has been monitoring the situation very closely, joins us this morning with the very latest. So good to see you. Quite the week.
Quite the week.
Quite the week indeed. So let's start off with where we are at today. When you're looking at things, the numbers of the air quality have come down a bit, but we're not out of the woods yet. What's your recommendation?
Yeah, I think you said it well, and your meteorologist said it well. Air quality has improved today. The risk level is reduced. We're going to adjust our recommendations today. And those recommendations are that the air quality is still not where we'd like it to be. The risks are mainly to people with underlying health conditions, lung conditions, heart conditions, the elderly and frail, those with weakened immune systems, and the very young. And so those folks should take some extra precautions. Everyone going outside, we still recommend wearing a mask. That's a great idea. And listen to your body. Yeah. You know, if your throat's itching, your eyes are itching, you're sneezing, your eyes are stinging, get back indoors. Get out of that exposure. The air quality is better now. It could fluctuate over the weekend, but we do expect it to improve over the weekend. And so, you know, this is all about taking sensible precautions at this stage. And, you know, these models are really hard to predict. It's hard to predict and know when the smoke is going to move and how far and how quickly. This was a very fast-moving circumstance, and so we're trying to get out ahead of it before the weekend with all the events you mentioned and have New Yorkers take some smart precautions.
I have a question that for people that have experienced symptoms from inhaling this smoke, how long can that last? Because for myself, I mean, I was wearing a mask, but I'm still feeling the effects of it, or I don't know if it's a cold coming on. It's just, so how long can that last?
Well, the symptoms that people should be watching out for first. Headache is usually an early sign that you're breathing in some particulate matter that might be causing you some harm. You know, difficulty breathing during normal activities or during strenuous activities, coughing, but certainly throat irritation, nose irritation, itchy, watery eyes. Those are the types of things that we look out for in terms of symptoms. Usually, for the majority of people, those symptoms are short-lived, and as soon as you're out of the exposure, they start to improve. They can last for a few days. It all depends on for how long you were exposed. The fact that you were wearing a mask was a really good thing, because that means no matter how long you were out, your exposure was reduced because you were wearing a high filtration mask.
So those events tonight, there's a lot going on this week in Puerto Rican Day Parade, Pride events, so on and so forth, right? Those are going to go on as planned. If you're somebody with an underlying condition, don't go.
If you're someone with an underlying condition, take precautions, right? You know, really consider whether you want to go out there and wear a mask. Wear a high filtration mask.
I want to give you the chance. I do want to give you the chance to respond to the critics who you addressed this a little bit yesterday at a press conference. Some critics who said there wasn't a plan in place. Officials came out too late addressing it, that we were already in the thick of the smoke before we heard from officials. What's your response?
Well, our health department started putting out messaging around the air quality alert midday on Tuesday. And that's right around the time that the state DEC put out their air quality alert. And at that point, the air quality was around 150, which is a little bit higher than normal for this time of year. And then within a matter of hours, it went above 300 and then even higher the following day. So this was a very fast-moving series of events, and we drew people together right away. You know, I think we have to be honest that on the one hand, we talk a lot about social media as a part of our lives and as an important conduit to deliver information through official accounts. And then on the other hand, we hear, well, why did you put out messaging on social media? It's an important way to get messaging out to the public, and we did exactly that on time. And then we brought all of our agencies together to start talking about this and say, all right, what can we do? We got a mass distribution plan in place that's underway now and ongoing. So I think people will look at this as we stepped up when we needed to step up.
Yeah, and we do want to talk about social media. But before I get to that, though, just a quick question: any chance that they could, the city could extend this air quality warning alert?
I think it's really all. First of all, the air quality alert. Typically, we follow the state's DEC air quality alert, which goes until midnight tonight.
Okay.
But that could be lifted based on what we're seeing.
Yeah.
It's all based on our forecasts and current conditions, and we'll be looking at our meteorologists to see how that's going to go.
So we do want to ask you about the social media summit that you held yesterday, addressing concerns about the impact of screen time on the youth. Can you talk about that?
Yeah, this was a big day. We're talking about environmental toxins, air toxins. We've regulated tobacco in the city. We work on lead, and we've improved the quality of our water. But we have a digital toxin all around us that is basically unregulated across this country, across this world, and that's social media. And it's in the hands of our kids. It's affecting their developing brains, and it's contributing to our youth mental health crisis that we're seeing. So yesterday, New York City put a stake in the ground and brought leaders together from all across the country, health departments, experts from the tech industry as well. Most importantly, we did it on a school day off to bring young people to the table. At every panel, in every discussion they were leading, to start looking at the solutions for how we can bring a public health approach to regulating this toxin.
So what are the young folks saying, right? Because when you look at it, you might say, well, they might just be listening and not in their head, but they're so glued to these devices, right? Because they're looking at adults who are glued to the devices at the same time, right? So it's kind of like lead by example. But what are they actually saying about it?
I think they are saying very clearly, number one, involve us in the conversation. We want to be at the table. We want to co-create with you because we're growing up with this all around us. Number two, they know that the more time they spend on these platforms, it's hurting them.
Yeah.
But they also want to see good role models from us as adults, and they want to see the companies do more for them, give them more information on how to use social media more responsibly, how to separate good content from bad content. And lastly, and I think most interestingly, they have a sense that the companies are boosting certain content. So when you click on something, that the algorithm is incenting that content to keep coming back. So whether that's good content or bad content, harmful content or not harmful content, they have a sense of that. It's innate, right? You start to say, why am I seeing the same things in my feed over and over and over again?
It's creepy almost.
They know that it's not right. They know it's not right, and they're telling us, do something about it.
Okay.
So they're asking adults to be adults and do something about it.
Yeah, well, parents need the guidance too. Dr. Vasan, thank you so much for coming in this morning.
Thanks for having me.